pregnancy is not a disease or an illness that needs any kind of treatment. It's a physiological process and it's a natural process. The worst that homeopathic medicine will do, it will not act. Conventional medicines, the remedies that are given, sometimes they be too strong. Now, homeopathy is a holistic science. It strongly believes in the mind-body connection, as you said, and it deals with the human being who has a problem and not the problem. It is based on remedies that are extracted from natural sources, whether plants or minerals, and they are not herbal medicines, So they aid the natural defenses of the human body. So you're actually helping yourself to heal yourself.
Hi, my beautiful, lovely pregnant friends, mothers planning the pregnancy and their supportive partners. A warm welcome to you again into our podcast. I'm again Sonia Pava, your friend and guide from 9 and Beyond, your holistic pregnancy app. And as promised, today we have one more expert on our panel for this podcast, a very famous homeopath, MD homeopath from Mumbai, Dr. Sujata Naik. Dr. Sujata,
Namaste to all you. Thank you, Sonia.
And we are really humbled by your presence here. And we are very honored that you have taken out your time to share your wisdom. I would really say more than knowledge, your wisdom about Garbh Sanskar, homeopathy, the alignment of the subject with our audience here today. And in her honor, let me tell you, she not only has a 30-year of clinical experience in Mumbai, across Mumbai, the patient, she has global patients all over because she is an amazing doctor. And she is besides being a great doctor, she is a great human being and is also running a charitable hospital in rural Maharashtra. And she's a great orator and hence always invited on different health forums, platforms to share her wisdom. She's a great writer, has amazing books on wellness coming from a clinical experience called the Wellness Capsule, the Wellness Shots, which are amazing. And besides that, the biggest feather in her cap is that she's the first affiliate member, international affiliate member of the Faculty of Homeopathy of United Kingdoms. And in that capacity is continuously invited there to conduct her workshops with GPs. And these are clinical workshops with GPs and homeopaths over there. Besides that, I know her incredible work she done in COVID times with her team, which was unsurpassable, of course. And her motto in life is that homeopathy, the wonderful benefits of homeopathy should reach every segment of society. And now the segment of society today is you beautiful pregnant ladies and the couples who are planning the pregnancy. So here we have her with us so that she can share her wisdom with us. So Dr. Sujata, it's really nice to have you over. And to begin with, I would like to ask you, see, we all know that homeopathy is based on mind and body connection. And like they say that your every body part is a seat of emotion. And homeopathic is basically based on that. So keeping that in mind, there seems to be a lot of alignment between Garbh Sanskar, because that is also a mind and body connection. And what do you say? How would you integrate homeopathy with Garbh Sanskar?
Thank you, Sonia. Firstly, thank you for that wonderful introduction. And welcome to all women who are planning a pregnancy, those who are pregnant, those mothers who are guiding their daughters towards pregnancy. So this is a wonderful concept, Garbha Sanskar. And as we know that we know that pregnancy is not a disease or an illness that needs any kind of treatment. It's a physiological process and it's a natural process. However, Garbha Sanskar, which means actually educating the fetus and the womb, Garbha is the womb and Sanskar is education. And the womb it's a voluntary process,
Right.
Of aiding the mother through a natural and a happy pregnancy so that it can have a positive effect on the unborn fetus and the baby that is delivered. Now, homeopathy is a holistic science. It strongly believes in the mind-body connection, as you said, and it deals with the human being who has a problem and not the problem. So it is not about disease prevention and disease control, but it is more also about wellness maintenance, about maintaining the normal physiological parameters of the body. And Garbha Sanskar is exactly that. It is aiding the mother to achieve an optimum state of health, mental, emotional, and physical during pregnancy that will aid the child to be born with an optimum state of health. So this is the alignment of homeopathy with Garbha Sanskar. And homeopathy is is based on the absolute natural sciences. It is based on remedies that are extracted from natural sources, whether plants or minerals. And they are not herbal medicines, because
Right.
don't confuse herbal medicines with homeopathy. They're ultra high dilutions extracted from natural sources.
Right.
And that's why they are, we can use them during pregnancy or even before pregnancy, because Garbha Sanskar is about from the stage of conception or even preconception and through pregnancy. So homeopathic medicines can be used throughout that period. So they aid the natural defenses of the human body. So you're actually helping yourself to heal yourself with homeopathy. So these remedies stimulate the immune system. So what they do is that homeopathic remedies are actually proven on healthy human beings, unlike the allopathic or the pharmacological doses that are proved on guinea pigs or on animals. These are on healthy human beings, so they're perfectly okay to be taken by pregnant women. And what they do is they stimulate the defense mechanism, the immune system.
Right.
So because of the similar law of similars which homeopathy is based on. So a remedy that is given to a healthy human being, the person will exhibit certain symptoms. And if those symptoms are used in a patient who is exhibiting those, you can actually cure the person of his problems. So even during pregnancy, when you talk about treating the pregnant woman, so it could be because it's a physiological process. So there could be symptoms which are physiological, but which can be irritating or annoying to the pregnant woman. So homeopathy can actually help alleviate those as well. And when it comes to an actual problem or a disease or an affliction, that's where it can also help the patient to get relieved of that, along with the conventional system of medicine that is used. So it's an integrated approach. And
Because basically what I'm understanding from you is that it is all about the wellness of pregnant.
absolutely,
So
absolutely.
the role of homeopathy is all about wellness
Yes.
more than anything else. And absolutely the wellness applies to Garb Sanskar.
Yes.
Because, Sujata ji, we had our Acharya ji, and I keep repeating this again and again in the podcast. He used such a beautiful term to encapsulate Garb Sanskar. He said, Ahar, Vichar, and Vyavhar. Your nutrition, your attitude, and your behavior. If these things are in place, and that's all about wellness, they will only be in place if it is a wellness.
Absolutely.
So, keeping that in mind, do you have specific remedies for wellness, which is mental or physical or nutritional in the branch of homeopathy?
We do have medicines to maintain health. However, remedies may not be used until there is an exhibition of certain symptoms. For example, as we said, that because pregnancy is a physiological process, so even if you don't intervene, don't do anything, pregnancy will still happen. It will conclude to a logical end, and that is delivery. But there are problems that a patient may face, even if they are not tangible, because of the past family history or the patient's earlier medical condition, or there is a genetic issue component which is attached to her health. And homeopathy will help to prevent those. So, in this way, it maintains wellness. So, you can give the constitutional homeopathic remedy, which is highly individualized. So, what is given to one patient need not be given to another patient unless it is absolutely indicated. So, you don't have one remedy for headache.
Right.
If a patient comes to you with headache, it's not one remedy that is given to all patients with headache. It depends on the patient's tendency and predisposition. So homeopathy not only treats the symptoms, but it also treats the predisposition. So if a pregnant woman says that there is a history of early deliveries or your preterm deliveries in my family, is there something that you can do to help me through this? So this is where you can take the patient's history in detail, which a homeopath does, and give her, based on that, give her a constitutional remedy,
Okay.
which will help her to maintain that state of wellness, to maintain the optimum state of pregnancy, so that she does not have a premature delivery.
Okay.
So she's not suffering at that stage. She's
Right.
at that moment, she's in a good state of health. But because of a predisposition, the constitutional homeopathic remedy can actually alter that state where she can benefit.
Do you have cases like that, where it has happened like that?
Oh, we have several cases like that. And genetic predisposition, the patient's family history, the patient's past history, her medical history, her state of mind when she gets pregnant, all that is extremely important to the homeopath when prescribing, because all these factors are taken into account to give her the constitutional dose. So, for example, we had a patient, who had siblings who had postpartum depression. Two sisters, her older sisters, who had delivered and had postpartum depression, severe postpartum depression, which needed to be intervened with antidepressants and certain other allopathic medicines. So when she approached us, she said, I have a history like that, family history. I am okay. I've never suffered depression, but I'm anxious that what can I do about it? Obviously, she cannot be given antidepressants in advance because she's not depressed at that time.
Right.
So can homeopathy help in such a situation? She asked me this. And yes, because the constitutional remedy given to the patient at the right time not only saw her sailing through a pregnancy, but not having any depression or any kind of mental or emotional disturbance even after delivery. So in this way, homeopathy can help in maintaining wellness, even if the patient does not exhibit any sign of illness or disease or symptoms when she approaches the homeopath.
This is amazing. So this is also giving me an understanding of the fact that this journey of pregnancy, especially in today's time where the couples are really knowledgeable and they actually plan their pregnancies, which is such a great thing to do. So this means their journey can be started way ahead in planning, and in case they have issues which are emotional or mental or physical, they can be taken care of with homeopathy so that their journey becomes very smooth and
Absolutely. Absolutely. So with the right constitutional individualized remedy, we can take care of several such tendencies and predispositions. For example, a couple approaching us saying that they had a conflict in their marriage earlier, and they're afraid that then they decide that, okay, now it's enough. They go to a counselor, get it sorted. But they're anxious that the state, they're afraid that if we have another, the mother especially, the would-be mother who plans to conceive, see that I am not sure if there's any such conflict, will that affect my child?
Right.
Because I'm prone to temper tantrums. My husband is angry and irritable by nature. So is that going to affect my child? Is it going to affect my fetus if I conceive? And will my child be born with some such tendencies,
Right.
So in such a case, definitely we can treat both the husband and wife.
Amazing.
Yes, and that can actually help to curb these tendencies, to make it a more happy time during pregnancy. And these are the things that we have seen, because homeopathy works at a very subtle level. It's not a quantifiable way of treatment, unlike the allopathic medicines. So which are aimed more at disease prevention, maybe through vaccines and other medicines, and disease control when you actually give antibiotics or hormonal pills. Whereas homeopathy does not contain any antibiotics or hormones. It's like fitting a peg into a hole, okay? And if you can't fit a square peg into a round hole. So if unless the peg is round, it is not going to fit into. It's about matching the remedy with the patient's symptoms. So only if they match, the remedy is going to act. And that is the true test of a homeopath, is that you have to take the history in detail and match the symptoms of the patient with the symptoms of the remedy that has been proven on a healthy individual earlier. So the worst that homeopathic medicine will do, it will not act if it doesn't fit.
Okay,
It fits,
but it will have no side effects.
they will not have side effects.
Amazing.
So adverse reactions with homeopathic medicines are almost unheard of.
Okay.
So that's why they are very, very safe to be taken before pregnancy, before conception, through pregnancy, and after delivery as well.
That means your homeopathy medicines are very safe for fetus and they work on
Yes, very safe for the
and the pregnant.
very safe for the fetus.
And from what I'm understanding, this means that this kind of constitutional treatment will obviously give birth to a child with a better health conditions. The impact will be better health condition, better temperament.
Obviously, the reasons are two here. One is that homeopathic medicines being safe can be given for any symptoms associated with pregnancy. For example, though we know that it's a natural process, but a woman can have symptoms like nausea, she can have symptoms like vomiting or headaches or body aches or sleep issues or anxiety issues or bowel disturbances. All these are natural things which are associated with pregnancy. However, conventional medicines, the remedies that are given sometimes may be too strong or maybe a little unwarranted, in this, but the doctor has no option but to prescribe if the patient keeps complaining of these symptoms. Here, homeopathy can treat these minor ailments very, very effectively, very successfully, and can reduce the dosage, which is required through conventional medicine. So in a way, you're protecting the defense mechanism of the patient protecting the immunity of the patient by not bombarding the patient with too much of medication. That is one thing. And two, because homeopathy works on the mind and the body,
Right.
right? So when she's being treated for a physical symptom, she is also getting emotionally and mentally more stable as she takes the medicine with the right medicine.
True.
So obviously this has a very positive effect on the unborn fetus. So a happy mother is going to, deliver a happy baby.
That's true. Right. So I hope you ladies out there are realizing one thing, that when we talk about Garbh Sanskar technically, if you break the meaning, is educating the fetus in the womb. But then it is not about just the teaching A, B, C, D or 1, 2, 3, 4. It is all about education, which is part of you, which gets imparted to the child for a better mental health and, of course, the better well-being, better temperament, better formation of the nature, right?
Yes, yes.
So that's what exactly is Garbh Sanskar, which is what we are trying to do here. So doctor, tell me one thing. Is it a good idea to basically combine conventional medicine with homeopathy? Do they support each other? Is it possible, or is it like, I am supposed, for example, I have diabetes and I'm getting treated for diabetes with allopathic medicine. Can I support this with homeopathy to enhance the treatment? Or is it like a no, that if you're on allopathy, you cannot touch homeopathy?
That's a very, very vital question, Sonia, and I'm sure that a lot of viewers will have this question in mind. To tell you very honestly, homeopathy works in tandem with the body's defense mechanism. So it can very well work in conjunction when the allopathic medicine is going on. It does not cause drug interference. There is no drug interaction when homeopathy is on. As I said, the worst that can happen, for example, if the patient is on very high antibiotics or steroids,
right,
for maybe an autoimmune disorder, which is like rheumatoid arthritis.
Absolutely.
So then the worst that can happen is that the homeopathy may take time to act. That's because of the strong suppression with the allopathic medicines, especially steroids, which are immunosuppressive. And homeopathy is meant to trigger the immune system for a response. However, in such conditions also, we have specific medicines which are given in low potencies and with more frequency, which may take care of the symptoms at that time. So we can give symptomatic treatment to help the patient see through that part. So they work very well with allopathy. So for example, if the allopathic doctor is giving a medicine for diabetes during pregnancy, then is pregnancy-associated diabetes.
Right.
The patient was not a diabetic earlier, has diabetes now, which is discovered during pregnancy. And the patient is put on anti-diabetic medicine. So with the individualized constitutional homeopathic medicine, perhaps she will require less of the diabetes medication.
Okay.
And ultimately, after delivery, we can even see that she is off the diabetes medication because of the constitution getting regulated with homeopathy. So in that sense, it does definitely work. Sometimes as an alternative, sometimes in conjunction, sometimes as a supportive. So homeopathy can be given at every stage very safely.
And it also works with Ayurveda? I mean, considering that all these sciences are now, it's very clear based on your mind and body connection. Each and every science is.
Yes.
Everybody's accepting that fact. So they can actually work in tandem with each other?
I'm sure they can. And though homeopathy is not a quantitative, though it's not a pharmacological intervention.
Right.
Because it works more, as I said, at the innate level,
Right.
stimulating the body's defense system. So it's not an antibiotic that is given for a specific period of time. So it should work with anything that the patient is on, except, as I said, that anything which is suppressing the immunity. As I said, very strong steroids or immunosuppressive medicines, then we have to then change our course of action and maybe give something at a more superficial level just to take care of the symptoms.
Right.
But otherwise, more often than not, we treat the patient constitutionally, taking care of the tendencies and predispositions.
So it's like they say, it is very, very advisable in today's time to actually plan your pregnancies way in advance, be mentally and physically prepared for it. And these are these lovely alternate sciences which we are available today to help you prepare your mind and body for, your a very smooth journey of pregnancy and in life, of course, like, giving your child the best of everything, probably. A very holistic approach, as I may say. Like,
having said that, Sonia, I would like to also stress on the fact that patient education is equally important. That when the patient is approaching a homeopath for something, the homeopath must educate the patient why this medicine is being given, what kind of effect we expect to see, and also keep in tune with whatever the gynecologist obstetrician is treating or monitoring the patient for. And this has to be done in tandem, in conjunction with knowledge of what is going on. You should not expect to substitute one treatment with the other. For the example, the patient says that I think I don't want to take this medication. For example, patient is on depression medicine, A patient who has been previously depressed is on depression medicine. It's not wise to take the patient off that medication just because she thinks that, oh, this medicine may harm my fetus. I don't want to take it. And then expecting the homeopath to substitute that with a medicine just because it's safer. We have to look at what is the larger picture, what is going to help the patient, because everything that we do is going to also pass on to the fetus.
Absolutely.
So the mother's state of mind during pregnancy is extremely important. And that's why we take everything into account when we take the patient's history. All her past experiences, whether they're emotional, mental, spiritual, whatever her family history is, her background, her approach to life, her perception, in what state she has conceived or wants to conceive. All that is very important because that is going to have an effect on the fetus, on the baby that is going to be born. And that if there is any aberration, any problem there, that can be corrected with the constitutional medicine so that the child that is born in optimum health.
Absolutely. So, when every time we direct this conversation, you can see the huge responsibility of a woman who is pregnant or is planning a pregnancy. The repeated thought which keeps coming to my mind and is what I am extending to all the supportive partners and the family members. I think it's so important. Like, पहले ज़माने में पूजा जाता था एक pregnant woman को, right? That take care of her mental health. Support her 100%. All you supporting partners and the family member so that she is in her ultimate state of well-being. Let's put it health-wise, physically and mentally and emotionally to give birth to a beautiful child, right?
Absolutely.
So I think it's very, very important.
Absolutely important. Support from the spouse.
Responsibility, no doubt. But I think the environment plays a huge role.
Yes.
And I'm like you say that, and I think homeopathy can really help because, these kind of symptoms can really be, like you said, temperament, the person who had. And if everybody around is taken care of, with emotionally, it can be a great journey for the couple.
That's absolutely right. And it's important to start this kind of education, start this kind of, looking out for those red flags,
right,
which may trouble the woman during pregnancy much before she conceives. So a couple who is planning a pregnancy must start preparing themselves at least several months before they actually conceive. And that is something nature has a huge role to play there.
Right.
Whenever they decide that, okay, now it's the right time to start a baby, thinking about a baby, they should make sure that the environment around them also is conducive to that. And homeopathy can definitely help because they can come to a homeopath saying that these are my tendencies, these are my problems which I have. Though they may not come in the way of getting pregnant, but those can be treated at the outset so that the woman, as you said, she can be in an absolutely happy state when she conceives. And that's the support that the family ought to give to the woman who decides to conceive. And though it's an absolutely natural thing, it's sometimes, in our country, there are, you see, the two ends of the spectrum. There are women who are absolutely neglected, and there are women who are like put on a pedestal just because they are pregnant. So either is not good. None of these things are good. But you see in rural areas where women just sail through pregnancies because they don't think that it's a problem at all. It's a physiological state and it's so matter of fact. So in a way, treating it as something absolutely matter of fact and it's a part of a natural process, that also helps. So a woman should be active. She should be what she should do different during pregnancy is to expose herself only to positive influences. That's very important for the unborn child. And sometimes the external factors may be positive, but internally the woman may be harboring negativity from her past experiences, whatever. A woman who has undergone repeated abortions is anxious. Will this baby be normal? Will I have? Or she's had a baby with some kind of congenital defect. The second pregnancy can be stressful. Or she's heard something from somewhere. Or late pregnancies, So in such cases, her mindset is negative, is probably not very conducive to a happy pregnancy. So in such a case, the woman can definitely benefit with constitutional homeopathy. So all her anxieties, fears, insecurities, negativity can be balanced out, can be actually weeded out with the right homeopathic dose. along with obviously
Obviously.
proper monitoring by her gynecologist and obstetrician.
And counseling and
Obviously,
yes, right.
true.
Yeah. And so, doctor, like we're talking about the mother, right? But at the same time, homeopathy medicines, I mean, for example, suppose there is a issue in the fetus. Can homeopathy even work on the fetus for specific medical issues or no? That's a field.
The thing is, because it's an oral dose, homeopathy is given through the mouth. So obviously what the mother takes is going to help the fetus. So we treat the mother and automatically, but obviously there are congenital anomalies, sometimes anatomical issues, which need to be surgically corrected. Or a patient having the baby having any metabolic issues, they might require active intervention with the allopathic doses. However, having said that, because homeopaths get to the root of the problem,
Right.
why the problem occurred in the first place.
Exactly.
So here the mother needs to be treated, because if she's treated, the benefit passes on to the unborn fetus. So you don't actually give the medicine to the fetus, but to the mother.
Okay.
Yeah. So but this is something which we have observed very, very closely. Is that a mother, suppose she has a history of asthma, for example,
Right.
right? And she's on bronchodilators and inhalers. We've seen that through the pregnancy, if she's taking homeopathy, which is very safe, the child born may not actually have these tendencies. And we have seen that in several children. If the mother is treated during pregnancies for these things, even if she's not in an acute episode, but we are treating her tendencies. So the baby that is born may not have these tendencies. So even her, for example, insomnia is such a common thing, sleeplessness, sleep issues during pregnancy. So rather than prescribing tranquilizers and sedatives to the patient, if she takes homeopathy, because we are trying to get to the reason why she's sleepless. Could be because she's anxious, she's insecure, or she's just not sleeping for whatever reason. And the medicine that is given is going to help her constitutionally. So you can actually keep the patients off sedatives and hypnotics and tranquilizers, because that then definitely has a detrimental effect on the fetus. Through taking tranquilizers and sedatives. So this helps the baby to be born more naturally and happily.
So, Jonathan, we are quite aware about your research work in the field of homeopathy, for which you won so many national and international awards and presenting papers all over. Tell me one thing, is there any research which you would want our audience to know, which is directed in the field of pregnancy or Garb Sanskar, which can really help them?
So there is a lot of research going on, Sonia, and there are a lot of clinical trials as well which are going on, where there is this community hospital which I visit every month, and we are planning to start a trial there for pregnant women, because it's a rural setup, and they have these Anganwadi workers, who go and help the women. And it's very interesting that not only are the women educated as a part of Garbha Sanskar, but their mother-in-laws are also involved, because they are the ones in rural setups, in most of the joint families in India. The mother-in-law plays a very important role in the woman's state of mind or health. So educating the mother-in-law as well. So here we can actually, through homeopathy, we can, form a kind of a family setup where their problems, their tendencies are taken into account and medicines are prescribed to them. So that is something which will start very soon. Good you asked this question. And we're going to start this. And yes.
This is amazing. Right?
Yes, it's definitely.
Go a long way in the wellness of a pregnant woman and the fetus.
Absolutely. Yes.
Amazing.
True.
Well, generally most of the fields come with their myths. Most of them, right? So are there any myths which are attached to homeopathy regarding pregnancy and Garb Sanskar which you would want to clarify or specify?
Yeah, the general myths, of course, is that they may not be safe to take during pregnancy. A lot of gynecologists and obstetricians warn the patients against taking herbal supplements or taking medicines on their own. And they're not wrong. But let me assure them and all the viewers here that homeopathy does not contain antibiotics, steroids, hormones, or anything that can adversely affect the mother or the unborn fetus at all. As I said, the worst that can happen is that it just may not help if it is being suppressed with other strong medication. It's absolutely safe to be taken throughout pregnancy, even before conception, after delivery, because homeopathic medicines are incapable of causing any kind of pathological disadvantage or any kind of a reaction that may be detrimental or cause any kind of toxicity. So that is ruled out. And this has been absolutely observed and validated by everybody who takes it. The gynecologist also and obstetrician need to be reassured that no medicine will interfere with their treatment. For example, if a patient is on a hematinic for anemia,
Right.
We are not going to give another dose to add on to the hematinic or to the calcium supplement, or say that you can stop the allopathic hematinic and take only homeopathy. Because sometimes you need quantitative benefits from quantitative doses. That's where allopathy comes in. However, we've seen that patients continue to be anemic sometimes in spite of iron supplements. And the moment those supplements are either withdrawn or reduced, the anemia comes back. So here the homeopath will get to the root of why the patient is anemic. For example, there are medicines we have a medicine called as China, medicine Natrum muriaticum, which actually can help the patient get back on track and see why the iron levels are not going up to the level that is desired, and actually help the hematinic to work better. We have even seen patients, pregnant women who are on AKT, which is anti-tuberculosis therapy. Sometimes a patient suffers from tuberculosis in pregnancy, and it's very difficult to treat such a patient because the medication is very potent. The patient may have side effects because of the medicine. Here, homeopathy can help the patient to retain those medicines better because we have medicines to reduce that nausea. So in that sense, the baby also benefits, obviously, because the amount of medication that goes in can be lessened. So even, and as I told you earlier, because it works on the mind-body connection, there's a tremendous connection between every symptom that is physical to something that has happened at a much higher dynamic level earlier. So even nausea during pregnancy, a woman who has a planned pregnancy, has a happy pregnancy, or has a wanted pregnancy, the child is welcome. The symptoms related to the pregnancy are much less because the mother is actually happy having the baby. But in unwanted pregnancy, you see the condition called hyperemesis more common in such conditions. Hyperemesis is excess of vomiting, nausea.
Okay.
And sometimes the patient has to be put on very strong antiemetics, which may harm the baby. Here, we get into the mindset of the patient. Why the pregnancy was unwanted. It could be conflict, disturbance at home, some other issues. And there we get to that and treat the patient at that level so that her nausea and vomiting start reducing automatically. So this is how homeopathy works, and this is very safe. And it works in conjunction with any other system that may be needed or given at that time.
Amazing. So, a fetus, I'm just looking at a very broader picture that a fetus, which has been, a mother who has taken a homeopathy help along with all her other things. This child is born and impacted by this kind of mindset is automatically going to grow into a much healthier human being with a healthier mindset. So this Garbh Sanskar is going to go into generations actually if you come to think of it.
Absolutely, bang on.
And this is an amazing journey if you look at it like why.
It's an amazing journey. Sonia, you will not, you cannot imagine the kind of shadows that we carry with us through our lifetime, all connected with our mother's state during pregnancy.
Absolutely.
So whether it is our physical tendencies, whether it is our predispositions to illness, to diseases, our mindsets, our insecurities, our fears, our phobias, a lot of this can be connected to our mothers.
Absolutely.
And Garbh Sanskar can play a huge role, and homeopathy can actually help aid this physiological process, which is so natural, but because every human being is not a machine. Similarly, every pregnant woman's story is different. She's a dynamic entity. She's not a machine. You cannot standardize beyond the point. There's so much of individualization, and that's where homeopathy can play a very, very huge role in optimizing that mental, physical, and emotional state of health.
I'm looking at it like this, that whatever your state, you're pregnant, you're planning your pregnancy, I'm finding this whole conversation as if it's a very calming thing on a issue. That if it is supported with homeopathy, it is it can have such a calming impact on so many issues, come to think of it.
Absolutely. And we are not even saying that it's homeopathy instead of this, instead of that. Exactly. It's homeopathy with this. So in a way, it's a win-win for the patient.
And I've never heard anybody put it out in words like this, that this is safe, it has no side effects whatsoever. So, you suddenly feel it's a very safe world to be in.
It is.
And whether it's a first-time treatment or it is a supportive treatment.
And I really wish as homeopaths that more people will benefit from this therapy, because all these misconceptions and myths can be then completely busted.
Absolutely.
And they can benefit from this system which is so safe and which has been around for so long. And
actually, it's a very old science.
Yes.
But like they say, sometimes it takes time to come of age.
It's
And I
more
think
relevant
homeopathy
than
is now
ever
coming
before.
of age.
And
Yeah.
today, Sonia, a lot of people from conventional medicine, even alternative medicine, realize the benefit of an integrated approach.
Yeah.
No system is standalone. No system. Homeopathy has its limitations like other systems. So the homeopath has to be wise enough, should be knowledgeable enough to understand where it is to be applied, at what stage it has to be applied, how much of it needs treatment, how much of it can be just allowed to let go. So these are extremely important things that if we do it together, that will actually help the patient to I won't even call her a patient because the
Yeah.
pregnant woman,
Yeah.
she may or may not be a patient.
Right.
The pregnant woman to achieve that absolute optimum state. And we can actually look forward to a generation of much healthier individuals.
Absolutely.
Much healthier individuals. Yes.
Which is like genetically
Yes.
and emotionally
Yes.
and
yes.
spiritually
Absolutely.
and holistically.
Yes. Yes.
And I think we definitely in the more beautiful world to be in right now with the kind of issues we have all around
Yes.
us and the challenges which are there.
Yes. For example, mothers who got pregnant during COVID times,
Yeah.
they had different kind of stresses.
Absolutely.
Their husbands in hospitals or their families in hospitals.
Yeah.
The mother, the pregnant woman alone at home, and the kind of fears that she would have undergone. We have been experiencing this on a very large scale now. And the babies who are born during the COVID era have different mindsets. Believe me, they are afraid to go out in public. Some of them they cling to their parents because they're the only persons that they have seen. They cannot, for some time, they couldn't identify people without masks. So all this was during when they were not born. So because the mothers faced those issues during pregnancy, that's when we actually could help the mothers, to overcome these phobias. We actually helped this woman. I can give you an example. This patient had approached us, and she was in her 6th or 7th month of pregnancy during COVID, and her husband was mildly diabetic, but just because he was mildly diabetic, he was advised hospitalization just because he was COVID positive. The parents-in-law were already in the hospital. She was alone. There was no help. And she said that night when my husband did not, there was no news about how he's doing. And my parents-in-law, my father-in-law, quite critical in the ICU. And she's like, I can't tell you how much distressing it was for me.
Right.
And the fear that she underwent, and she said something can happen. Every moment she was afraid. She went into panic attacks. And that's where when she approached us, there was a remedy called Stramonium, which helped her beautifully. It's a homeopathic remedy called Stramonium, which was given on her constitution and her state of mind in that time. And that worked so beautifully. She got out of her fear. And today, the baby is coming to us for some minor issues. And he doesn't show any signs of fear or phobia. So, we can actually connect the dots and see and how these things impact the unborn topic. Like,
Of whatever happened has happened, but now give them a bit.
given in time, it can definitely help.
The more I'm meeting, knowledgeable people like you from different fields, this realization, which actually Acharya pointed out also, that there is so much research on agriculture, on your produce, on your animals. I feel like, honestly, at school level, we should have conversations by homeopaths, by Ayurvedic doctors and allopathic doctors, educating the generation. See, these are also general things,
yes.
but specific treatment is something else. But this is so beneficial if a child, like for example, this same woman, if suppose in 10th standard, as part of her education, she was aware of all this, she could have dealt with the situation much better.
Yes.
So, for this mental health, basically, I feel it's so important that
Yes.
probably these...
So education and counseling at the right time, knowing about which system
I wish we could do something about this, like,
is very, very
at a
important.
very early stage in life whereby the children...
And of course, by couples, I think once they get married and they decide to start a family, they ought to consult, whichever system they believe in, they should consult and seek help.
The part of the prenatal
Yes.
education should be people from different...
Even before they decide to
get the
conceive.
inputs on how it can be dealt with, so that they can have a complete help from every department which they want.
Yes.
And there is help. The beautiful thing is there is help, but probably people are
So that Abhimanyu, when he went into the Chakravyu, he couldn't come out because he wasn't educated enough.
Right.
So every baby will know how to, when he gets into a Chakravyu, how to get out of it. So here the Chakravyu could be a disease or an illness.
Absolutely.
And he will know how to deal with it because he's been equipped enough during the pregnancy state of his mother.
Anything else, doctor, which you would want specifically the audience to know, which is of great importance?
Yes, so what I would like to specifically, as I said, that you should approach as a homeopath.
Yeah.
You should approach a homeopath for three reasons when you are planning to have a baby. Is one, to remove all those predispositions and all those tendencies which the young mother, the mother who's planning to conceive, may be having through a family history, her genetic predisposition, her own past medical history, or her current health status. Depending on that, she must approach the homeopath and take her constitutional remedy, which will help to remove those predispositions. Once she is pregnant, for all her minor symptoms that may be associated, every woman has some symptom or the other when she gets pregnant. Try homeopathy, take homeopathy as the first line of treatment. And if that doesn't help, then go for your antiemetics, anti-nausea medicine, or your painkillers, or your headache medicines, or your sleep medicine. Take them. So if homeopathy is given at the outset, it works much better rather than after being suppressed with the strong pharmacological doses. And three is even after delivery, because the birth process is a stressor for the mother as well as for the baby. Baby is getting exposed to the outside world, is coming to terms with his new status, as an individual. He was or in his mother's womb, depending on the mother's placenta for food. Now he's an individual. So as soon as he is born, if there is any issue, you can also keep homeopathic supportive medicines ready for the mother and for the baby. So that, the baby absolutely in the neonatal stage, if he can do this, whatever issues that he may have had, he or she, during the pregnant state of the mother, can be solved at that stage so that he can grow into a healthy baby later. So for all the three stages, homeopathy can definitely help. And this is something that I would like to encourage all your couples who are planning to start a family to start at the outset. You don't have to wait to get ill or to have any problem to approach a homeopath. A homeopath maintains wellness and not just controls disease or prevents it.
Amazing. I think that's a beautiful conclusive sentence. And today it's all about wellness.
Yes.
Absolutely,
Yes.
So thank you, Dr. Sujata. This was such an amazing, knowledgeable session. Thank you for all the wisdom that you have shared, and all you beautiful people out there, couples planning pregnancy or who are already pregnant onto this journey. We just hope that all these podcasts are really helping you in whatever issues you might be facing. And you're always welcome to ask questions. We are always there. Please do put in your comments from time to time so that we can help you in places where we feel that maybe we haven't realized it and you need that. We're always there. And all our prayers and blessings for a smooth journey to all you pregnant couples, and blessings for people who are planning their pregnancies. So take care till we meet again. Bless you all. Thank you.
Thank you very much.
Thank you so much.
It was an absolute pleasure. Thank you very much.